What's up, guys? This is John Nelson, and you're listening to the Starting Block Podcast. This, guys, is a show for complete athletic development. We are here to give you the tools to win, whether you're the athlete, the parent, or the coach. If you're new to our show, we operate a little differently. We actually have multiple shows within our show. So the first episode you are going to hear from us will be our Q&A. It's a bi-weekly episode where myself and my co-host, Chris Scarborough. What's up, sir?
Hey, good afternoon.
That's where Chris and I will take the questions y'all submit to us and break them down. That's going to be everything from training, performance, rehab, nutrition, the neuro stuff. We'll tackle all that in the Q&A. Chris, where can they submit questions?
Info at startingblockpodcast.com. Excuse me. Info at startingblockpodcast.com. Yes,
okay.
I'll get it out in a second.
All right, so that's Q&A. Next episode is the other bi-weekly episode, guest interview. That's just like every other podcast on the planet. That's where we're going to bring in guests, our colleagues, friends, people who share the same core values and mission that we do here. They're going to share their stories of success, their systems, what they do with their clients, their patients, how they win. And ultimately, these are people that you can connect with no matter where you live in the country, somebody that might be able to help you, your family, your team reach their goals. I'll bring our guest on here in just a minute because that's actually what today is. We'll bring him on in just a second. And then the final thing that you'll hear from us is going to be that solo episode that'll come out again at some point. That's going to be, about 10 to 20 minutes of me just sharing a little bit more off topic, in our industry, in the rehab, the fitness, the strength, the athletics, something maybe a little more motivational, maybe something happened to me this week, just something that I feel like resonates with people and it's just valuable information for, all of us coaches. We live in a society that is ever changing at the moment. I think we are all dealing with a lot of different things, a lot of different challenges. And so I think it's good we just connect, and that's kind of the objective of that episode, is just, to share some things and network and communicate that way. So those will be coming back soon. As far as we have a fee, we do not run ads, but we do have a fee, and we ask that you pay your dues, guys. If you learned something from this, if you like the guests that we brought on, if you didn't completely hate, me and Chris, then, guys, share the show. Bring us a friend, right? That's all we ask. Just share the show. Help us grow this mission. We've had some awesome people on, had a lot of great discussions, and just share the show, man. That's all we ask. So that is how our show operates. I think I got it covered, right, Chris? Anything else?
Believe you got it. Did a great job, John.
All right. Yeah, that was record time, too, because I'm ready to get going. We got good stuff today. So, as you can see from the title, we are pleased to welcome back Mr. Shawn Sherman of Square One. What's up, bro? Thanks for coming back.
Hey, thanks, guys. Good to see you again.
Shawn.
Thanks for having me on your show. What's up, Chris?
Hey, what's up, Shawn?
I'm doing well. Appreciate you guys to have me back on, so thank you.
Yeah, most definitely. Most definitely. So it was good to connect the first episode, and guys, I'd encourage you, if you're just now, if you're catching on to our show, I'd encourage you to probably listen to the first episode we did with Shawn way back in the beginning. I mean, Chris, that was probably like episode 11-ish or something?
Yeah, something like October, November, somewhere in there. I think almost it was right in there.
Yeah.
Shawn, I believe
Yeah,
it was
well, we had
before
our
you came to
1-year
Birmingham.
anniversary, Shawn. Like, we've actually been on now for a year.
Okay, cool.
Yeah.
So, Chris, did we do this right before we had a workshop at your place, or was it right after? I can't recall.
Yes,
right
we had. It was in I believe we released that in November, and you came to Birmingham in December, I believe.
Yep,
So,
there you go. Wow,
Yep.
That's crazy. Time flies when you're having fun. I thought that was like 6 months ago. That's crazy. Wow.
Yeah.
Yep.
Yeah, so it's already been about a year. And you're right, time goes by fast, and I can't believe we've actually been doing this a year. I'm going to totally mess these stats up. I think I shared them with Chris at some point, but it's just podcasting stuff. I think they said somewhere along the lines of 90% of podcasts never make it past 3 episodes or something. And I think for the remaining 10%, I think less than 2% of those continue on. So you think about the just sheer volume of podcasts out there, but the fact that holy shit, we've actually been doing this a year, and people still want to listen to us, and guests want to come back. That's awesome.
The 1% right there. That's amazing.
That's right.
That's big time.
So, you advertisers with the big pocketbooks, let's go. Hit us up, all right?
We're here to stay. We're here to stay. Come on.
Yeah, but yeah, like I was saying, if you're just getting into this show, I'd encourage you to go back and listen to the first episode with Shawn, because this one we're going to dig a little bit deeper into Square One, talk about maybe some case studies they're doing, things that maybe current practitioners might be able to get a little info from, and so I'd take a look at that. Probably like I said, episode 20 or less. So. Yeah, with that, man, Shawn, you've had a heck of a busy summer, haven't you? You've been all over the place.
Oh my gosh, it's been, well, since I saw you guys last. I think I saw, when I last talked to you guys, I just got back from France and England. So in the last, what it's been, 10 months, oh my gosh. It's not like I'm bragging, but it's been an amazing year. So we had I got to go down to the Air Force, not the Air Force Academy, but the Air Force was the Special Forces guys out there in Albuquerque with Jess Langvart and some other fellas. I got to go to Australia, got to work with Chris Hemsworth over there. They put a workshop on over there in Sydney, so that was pretty amazing stuff. Been to Italy, going back to Australia here in about 4 weeks, 6 weeks. Oh my gosh, Omaha, Texas twice, New York, coming up again to New York. I know I'm forgetting a couple of ones. Omaha, Nebraska, California. I know there's like 3 or 4. Virginia, there's a few more we missed, but it's been it's been a busy like 4 months, but a really busy like 10, 12 months for sure.
That's awesome, man. Good for you. Glad to see the system continuing to grow. But I want to stop right there, and I got to ask a little bit. I mean, now obviously I understand, client, patient, confidentiality, that good stuff. But what was it like working with Thor?
Awesome. Honestly, super, about as down to earth as you could be for someone in your mind is kind of like almost the whole world would recognize. So that was pretty cool. Really cool. I get to hang out with his buddy Luke Zaki, who's his personal trainer. I get to stay at his house, so he was calling me roomie. I mean, just an awesome guy. Because I went up to Byron Bay where those guys live, and I didn't have shorts or anything because I thought I was just going to be there for a day, and I ended up staying for a couple days. So hey man, here's some shorts. Go out to the beach because he lives a couple doors off. Luke lives a couple doors off the ocean, so I got to go to Chris's house, and kind of a pinch me kind of moment for about 2 days there, and
it's like you made it if you're hanging out with Thor.
It was crazy, man. It was like, it was pretty surreal. It was pretty cool.
So awesome. were you on set with anything?
No, but it was so it was just at his house, and I don't want to divulge too much about like details or confidentiality or whatever, but I know the day after, these guys, they surf like crazy, and when I was there, I didn't get to meet them, but they were literally surfing with Kelly Slater. I mean, this is like, it was just kind of weird, like all these household names that are like kind of like either with them or nearby. And Luke said the next day that Chris is the best he's ever seen him surf, and they've been buddies since they're like 7 or 8 years old. So he's like, there's something that changed, and then so it was cool on the way back. We got to get to go on their private jet back down to Sydney because Chris had a GQ shoot. I mean, it was like really. It sounds like I'm making this crap up. It was pretty surreal. I mean, it really was. So really nice people, really nice, gentlemen. They just made me feel at home. So yeah, wonderful experience. Absolutely.
Great.
That's awesome. That's awesome.
Super cool.
So what's all right? So Square One is everywhere. It seems like now, clearly across the world. You had one of the biggest summers you've ever had.
Yeah.
What because Square One, your system, like it addresses like alleviating pain, but also like enhancing performance, right?
Yeah.
So I'm kind of curious. Like, have you seen so how do I want to phrase this? Have you seen it branch off into one side more than the other, or are you still kind of 50-50 with it? Where has it gone over the last few months?
Like as far as like performance versus like pain alleviation, rehab-y type stuff, or
yeah. Because I mean, in essence, it's the same system. You're still using the same theories, but like with two different end results, so to speak.
Well, yeah, and to me, all that stuff, whether it's pain alleviation, improved mobility, run faster, better reaction time, better vision, cognitive processing, whatever you want to call all those things, to me, it's all just outcomes. And I always say, like, I have zero control over what the outcome is going to be. So I'm very much process oriented, and I'm trying to teach my students to be process oriented and just like, hey, let's find out where the gaps are in this neuromuscular communication, address that. It's really, I guess, sensory integration deficits, address that, and just when the dust clears, let's see what happens. So I always feel like I'm not in control at all of what the outcome is. It's just really, I'm so grateful. I feel very thankful that it's like 90 or 95% really, really positive outcomes. I just don't have a control over it. But as far as who we're attracting as clients, or I should say as students, we're definitely, I would say in the last year and a half, more and more and more, it seems like strength and conditioning people who are finding us primarily. Definitely the personal trainers for sure. Some Pilates people, massage people, PTs. We even had an orthopedic surgeon as a student when was over in Italy teaching this summer. So we're kind of getting a little of everybody, but I would definitely say the strength and conditioning people are the ones who are really kind of stepping up and embracing this.
Why do you think that is? How are they utilizing it in a different way than maybe
I think it comes down to, I think strength and conditioning coaches, I think as much as anybody on the planet care about results. Like they're singing for their supper all the time. If they can't produce results, they're just not going to be in business for very long. Versus if you're in the more traditional rehab route, you're very much protected and insulated by the system. Like it's really incentivized to kind of suck at your job. Like if you get somebody better in 30 sessions, you make more money than if you get them better in 3 sessions. But a
Right.
strength coach is like, I want my guy better yesterday. So I just think that our message and how quick it can work and how quick it consistently works, it just fits really well with that strength and conditioning deal where they want to get back to the business of training. And I'm not trying to teach people corrective exercise. I'm trying to give them a system that they can use, whether it's for 2 minutes, an hour, but on that front end, put some work in, and then get back to training ASAP. So I think it just fits really well with what performance people are after.
All right. So, hey, I got a question, Shawn.
Hmm?
So let's. Well, actually, it's 2 questions.
Yep.
So first of all, like you said, I mean, it's not like we're out there. You're not out there advertising. Hey, you have back pain? Come see me. You
Right.
have knee pain? Come see me.
Right.
It just so happens that a lot
Yes.
of times when people have these,
Yeah.
back pain, knee pain, whatever, fill in the blank. It just so happens they seem to get a lot of positive results
Yes.
as a result of going through a square one session.
Correct.
So I mean, I want to clarify that because this is
Yep.
not a rehab system per
It's
se.
not.
A
No.
rehab person can use it certainly,
Absolutely.
but I will. But let me vouch for what you just said. There's a reason why I'm not practicing physical therapy anymore, and it's for the very reason you just mentioned.
Yeah. And I'm not trying to pick
I
on
was
anybody.
I was incentivized to suck at my job. I
Right.
loved what you said. I was incentivized to suck at it,
Right.
and that it does not sit well with me.
It
So,
doesn't- right.
po-
Oh, man,
and
sorry.
so no. I mean, I agree with you. So
Yeah, I know you do. I'm
it's
chopping at the bit.
but I guess. Well, go ahead. It sounds to me
Let
like
it
you got
fly.
something
We're
to say
not
on that.
politically
Yeah,
correct, Shawn. Go.
Let it fly, Shawn, because I got a follow up to that.
Well, but it's so true, and it's like I'm never trying to attack any individual, but just the way of doing things, the way things have emerged and evolved in the medical community, it's like it doesn't put the patient first. So
No.
many people who find me, like I don't, like you said, I don't advertise that I alleviate pain, but that's who finds me because what happens is they're now out of the insurance deal, so now they're reaching in their pocket, and they're not going to pay somebody $300 a session to put their foot in a freaking bucket of ice and hook up the electric stim machine that didn't work the first 40 visits. It doesn't make sense. So most people find me, they're kind of frustrated that the mainstream traditional stuff didn't work. And I sell, 1, 3, or 10 session packages, and I try to get most people in a 3 session package if they're approaching me for pain. I say, look, if I don't get you markedly better in probably the first 2 sessions, but certainly within those first 3, I'm going to help you find somebody who might help you. Because that's about all I typically need to find out if this is going to get them at least 50% more out of pain or totally eliminate it. So people are coming in kind of like out of hope because they've been told by the traditional people, oh, nothing can be done. And I'm like, that drives me freaking crazy. I'm like, no, nothing can be done that person has seen, but they haven't seen much of anything if they're talking that way. It just shows their ignorance and their arrogance. So we get a lot of people coming in with no hope and we help them. And then all of a sudden they're like, why didn't my PT do this? I'm like, yeah, because they're towing a company line. They're following the Betty Crocker cookbook of whatever they freaking taught them in PT school, which seems pretty unremarkable to me based on the hundreds of people come in and find me when it doesn't work, and then yet we help them and they're blown away. Like, why did this only take 1 or 2 sessions with you versus 30 sessions with the pro, the expert? I'm like, well, it's time for a change, and I think. You guys see my posts, and I know you guys are both doing that. You're doing some Square One and doing all kinds of different neuro stuff. There's a neuro revolution coming, and Square One's not the only dog in this fight. There's other systems out there, and I think the RPRs and the NKTs and the MATs that I came out at Square One, there's so many cool things out there, and it's just, by far and large, it's just mopping the floor with traditional, everything's about the tissue approach. It's like we got to start with the brain. We're not anti the tissue, but we got to start with the brain because movement starts with the brain, so we should start with the brain before we go into tissue work, personally.
Right.
I believe.
Yeah.
So let me follow that up, John, real quick,
Go
if you
ahead.
don't
Yeah,
mind.
go ahead.
All right. So you have I'm going to call it the 3-prong system. Okay. I mean, I know you gave the acronym of, first we gotta interview the nervous system and blah, 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 down all the way down to, we're gonna
Trigger train.
train or trigger. Right.
Yep.
But,
Yep.
hey, but I want to go through some of the different methodologies, meaning we
Yep.
have the proprioceptive, which was your original online before we ever got the in-person. program.
I was doing workshops pre 2020, so and that was all yet the proprioceptive, and it's
Right.
now our level 2 when you do the. So yeah, it was the first online piece we put out was actually it was 6.6, and then it was a square one online. So sorry to interrupt, but yep,
Right.
we were doing workshops pre 2020. It's just since 2020 things are starting to take off pretty
Did
good.
something happen in
Right.
2020? I don't remember.
I don't know. Some biowarfare attack against the world's
Okay.
people. I don't know.
That the U.S. had nothing to do with, right?
No, we're clean.
okay.
We're always the innocent ones.
Gotcha. Just to clarify.
But as far as, so we had the proprioceptive. Okay, that part was in there. That was from the get go, and this
Yes.
was pre 2020 when I started all that.
Yep.
So then, of course, we actually go to the in person thing. We also get the vestibular and the visual systems added into that.
Yep.
Do you find that you start with one of those visual vestibular, and then if something doesn't quite work, then you go to the proprioceptive? Do you start with the proprioceptive, then go visual vestibular? What is your particular, what is your typical
How do I do it?
pattern there?
Great question. Yep. And for those who haven't been through square one, so when we do the vestibular and the visual resets, it requires a lot less knowledge. It's super, super fast. Running
Yes.
and then the proprioceptive piece is still very fast. So that might take me, the clear level at 10 seconds as opposed to like 3 seconds. But it's definitely more knowledge involved. So it's a little bit, less, it's less sufficient, I would say. But still, you can still clear out multiple layers of compensation within a minute. What I do with every new person I meet, as long as I have at least, 15, 20 minutes. Now, if I'm with a team and I only have like 5 minutes on 20 guys, I'm going to go right into vestibular and the visual and just not care too much about the details because it's really a numbers game. I don't have a lot of time to invest in each person. But when I have an hour with somebody or I have a half hour with somebody, I do start with the original. I do start with the proprioceptive piece because it's, to me, I always talk about this analogy of interviewing the nervous system, and I want to get as much detail as I can. And with the proprioceptive piece, there's definitely more details that you are going to get as a practitioner. And what I'm really looking for is atypical, not classical type presentation. Meaning, if someone has knee pain and the first 20 layers I clear out of them is coming from their neck and jaw, that's pretty cool information to have. So that's why I start with our level 2 or the proprioceptive piece. I'm looking for the weird cases. Now, if I'm working with somebody who have knee pain or hip pain, and I'm just finding all these issues running the level 2 proprioception in their back and their hip and their knee and their ankle, it's pretty classical, then I'll quickly get into the vestibular and visual piece and then I make the assumption that it's more straightforward and classical. So then I'll just occasionally dip back in the proprioception piece, make sure what I'm finding is still in that same area from a proprioceptive piece, aspect or vantage point. And as long as it's really classical, very local, the issues we're finding, the source is being fairly, anatomically in close proximity to the symptom, I'll just keep running the vestibular and visual piece. But as soon as things start straying 2, 3, 5, 8 joints away, then I kind of put on that level 2 hat because I'm like, okay, this is a little weird. Because then what I do is once I find out, like I just had a guy 2 days ago, my buddy Jordan came in and he had, what do you have? He had something in his right foot or right toe. It was right knee, and we're working through this stuff. And at first it was knee, and then it was ankle, and then it was knee, and then hip, and all of a sudden we're up in his neck. And then we're going down his arm, and then this knee pain went away, and then his left big toe hurt. Like, that's freaking weird, but I'm not going to flinch because it's neurology. So I just kept going, and it led us to his palm. And he says, holy crap, dude, 3 weeks ago, because we played softball and rugby, because I took a softball right there, and he hit this bruise there. So then once I found out that they had that issue, I start selecting triggers based off his hand, not based off his symptom that he came into of the knee and the left toe. So I just went to town on his hand. And the next day he's like, dude, this stuff is crazy. Like, I have no pain anywhere in my body. He's feeling great. So, long answer, very straightforward question. But I like doing level 2 to get details. When it's weird stuff, I stay with level 2. If it's pretty classical, I'll kind of just do the quick level 1 stuff.
Mm-hmm. Well, and I've often wondered, like, let's say that you find, that level 1 stuff. Okay, by the way, when we're saying level 1, we're referring to visual vestibular. Okay, just to clarify to the
positions and 4-eye positions, so it's pretty simple. There's just very few different types of resets you need. Yeah, and the level 2 proprioception, there's over 200 joint actions in the body, so just have a bigger library of options to
right. So, but let's say that you find a correction that you can easily handle in level 1.
Yep.
Okay, with a visual, let's say a visual correction.
Sure. Yep.
Would it be the same end result, you think, that if we found that same thing in a joint in one of the proprioceptive? I mean, we end up with the same result in most cases.
Yeah, I would say the operative word was do I think? I would say yes, I think that is true. I always use the analogy of there's one building and there's 3 doors into it. Visual, vestibular, and proprioception. If we
Right.
restore order to one, there's going to be more resources of the brain to run things as efficiently as it needs. So I personally, at this point, I don't have a pet reset. I think that they all work equally as well. I don't see a lot of evidence that one is markedly better, other than the detail, and then that's more beyond. But where the rubber hits the road, I think they work equally well, honestly.
All right. Well, John I got to say, the stuff that John does at his clinic. I mean, it reminds me so much
Cool.
of what Square One taught me. I mean, it reminds me so much. Because
Awesome.
first I saw John grab the back of somebody's head, not grab it, but
Yeah.
touch the back of somebody's head, and all of a sudden his knee gets strong. I'm like, what did you just do? He's like, I don't know.
believe it.
It's like, you find the spot. It's like that's
love
what
it.
you're doing. Yeah. So anyway, sorry, go ahead,
Neurology's
John.
crazy,
I tell you.
man. It's awesome. It's awesome.
So, all right. So we talk about trigger train. All right. And Chris mentioned that to me. And, I've heard you say it as well. Now, I want to go through like a case example here, because I think there's 2 things that I think would help, me, again, understand the system a little bit more, but also, your other coaches and practitioners utilizing this. So with the trigger and train, Chris and I were having a conversation yesterday, just about what we're going to talk about today. And we use the example of somebody with shoulder pain. I would say shoulder is probably one of the top things I see. I mean, would you agree with that?
I see hips, back, shoulders. Would be the 3.
Yeah, I mean, I see it all, but
Yeah,
shoulders
exactly.
are pretty high up there, I
Yes.
feel like,
Yep,
right?
absolutely.
And there's a lot of working components to it. So, I use the example, and tell me if I'm not communicating this in Square One language. I'm going to communicate in the language that I know.
Sure.
So we're just going to hypothetically use, middle-aged guy coming in, he's got some neck pain, right? And let's just say, right side of the neck's bugging him. Okay, so we're going to take a look at the muscles, see what's going on. We're going to find an indicator muscle. Let's just say we're going to use the left upper trap, right? Boom, left upper trap, it tests fine, okay? Everything's checking okay. So from Square One standpoint, we know we got neck pain, but, trap and stuff is checking out fine. Now what are you're going in to try to trigger that to get it to shut off, correct?
Possibly, but I would probably I would search the body and just find any failed muscle test.
Okay.
So I don't need to I don't need to test the area of pain. I could do a foot test, a torso test, a leg test. So I'm looking for one that fails, and then from there I'm like, okay, we're starting with fail. Then I basically
Fail that doesn't hurt. Fail that doesn't hurt.
a
correct?
pain-free fail, because obviously
Yeah.
I don't have MRI or X-ray eyeballs. I don't want to damage tissue because I don't actually see through skin and bones like maybe some people might think. But what we're looking for is
Chris Hemsworth could maybe help you with that.
So then, I find something that fails, and then I really just we pose them. You could say whether I grab a joint or I have them actively visit a joint position that correlates with what we call right step or left step. So like when the right foot hits the ground versus the left foot hits the ground. So it could be like right toe flexion, and then I'll check that failed test, and then I'll check left toe flexion and see what happened to that failed test. And what we're going to see most of the time is there's going to be one fail, one positive. So there's going to be order restored, or there'll be chaos ensuing. So we're just looking for that pattern preference is the next step we do.
Okay, so we use the example of like the guy, is a salesman, and you figure that out, and it's the cell phone that constantly is shutting everything down.
Okay.
Right. So like you challenge it with the phone, right?
Yep.
So I know, as Chris was saying, you're trying to identify these types of inputs that are shutting stuff off.
Yep.
Where do you go from there? If the cell phone is something that's creating, bam, it shuts that trap down.
Right.
How are you creating enough stimulus, and how are you, and what stimulus are you using to get that corrected?
Awesome. Yeah. So we'll use the cell phone as an example. We found that it's like 2 points of contact. So if you just hold the cell phone, it doesn't usually have a noxious input to the body or a response by the body. But as soon as there's 2 points of contact, both hands touching or grab the phone, hit your torso. So we would use that as a trigger. Okay, our indicator fails. And then just like I was saying, I will find out right versus left preference. And then once I find which phase, right step, we'll say right step creates better organization and left step causes further disorganization. What I'm going to break down then is I'm going to find out where within right step, mechanically or neuromechanically, which joint action, which joint position is being perceived as a threat under load by the brain. So for example, maybe it's, if it's right step, maybe it's like shrugging the left shoulder or protraction of the left shoulder. So we have them do that. We're expecting a solid response by that muscle test. It actually fails. So the input there would just be to visit the position. So the proprioceptive reset would be to just to spend at least 2 seconds performing an isometric into that presently load intolerant joint action, and then we just check her work. And that means that at that point there should not be a preference between right and left step. It should be homeostasis or balance between those two phases. And then I would go right back to the cell phone, re-expose them to it. If it triggers, okay, pattern preference, right versus left. Then we chase after the organizing phase, find the action that should be solid that's not, feed them an isometric, clear it, have them hold the phone, and then that second, third, 10th exposure, all of a sudden their nervous system doesn't react to it. So we're raising the integrity of the nervous system by giving very hyperspecific either proprioceptive inputs like we just described, or we could also do vestibular and visual inputs that also correlate to right versus left step.
Okay. What are you using anything? How are you measuring the amount of input that you're providing to the person, knowing that it's not like exceeding something like their metabolic threshold?
Well, because like the inputs are just a low grade isometric. So, I mean, if they want to go 100% effort, they can. But we've actually messed with this where you can actually use conscious intent and think about the joint action. So you don't even have to physically protract your shoulders, as an example. If, say, maybe that guy's surgery, he had a surgery there and you want to be careful with it, you can literally have a mental, perform mental imagery of shoulder protraction. So you can go as as light as you want. So we found that whether you use conscious intent or 100% effort, it doesn't matter. What we found is it's more of the duration. So I don't know exactly when that conscious intent starts. I don't know how we take, okay, go. How would we really know when that starting point is? But as best as I can tell, it seems like once there's that about 1.5 seconds, 2 second conscious intent directed at that joint action, that's sufficient input to the system to create that safe environment at that joint action again. So the input, so the answer is we don't measure. We just literally just perform that and just literally hold the position. So just have to have that little bit of focus on that position.
Okay. All right. Well, changing gears a little bit into another type of scenario, one that has, I think since you've come on, it's become a little bit, the first time, it's become a little bit more of a topic, and that's concussions.
Okay.
And I think I'd really like to, dive into square one with concussions. And one of the things that Dr. Rob Lucky mentioned was that physical injuries, get better over time, but neurological injuries get worse over time. And it's not uncommon to see somebody sustain a concussion and then, 6 months later, something else ends up happening. And I feel like it's almost textbook. And in I'd say our industry, but in the rehab, the healthcare side of stuff, training, whatever, there's, at least I know where I live, there's not a whole lot of concussion rehabilitation. It's very much, okay, you have a concussion, boom, you go in, okay, is there any hemorrhage or anything? Okay, no, wait until you feel, no symptoms, you pass the test, boom, you go back. But that doesn't necessarily address any of the neurological compensations or neurological degeneration that actually occurred from that. How do you utilize square one in that sense if somebody's, if they took a blow to the head and their, the right cerebellum has just eventually just degraded? Like, how are you evaluating that with square one?
I would do the same thing whether you had an ankle sprain, you have depression, you have a TBI, no matter what the issue is. Well, I'm looking at movers first, and I'm just still going to compare right versus left, up versus down, and just find that preference. Find out what's causing the preference, like what's the brain really working around, and just give them the inputs. I would so recent, as a case study, I have this recent client who came up from. I live in Pennsylvania. He came up from North Carolina. My wife's really good friends with his sister-in-law, and so he came up and he long story short, he fell and hit his head like a year, 15 months, 18 months ago. And, so he was having headaches every day, very irritable, like almost like a different personality is what his family's saying. Like he's just not the same guy. He's just like, he had a head injury, and it's a bit of a mess. And big time concentration issues. Like it was hard for him to do his work. Like he can't do, like it was hard for him just to focus on one thing at a time, let alone having to answer the call, drive the car, talk to his client. I mean, he's kind of a wreck with work. And we work on him, just basic square one. And some of the triggers I was using is, hey, just stand up. And okay, now put one foot in front of the other. Okay, let's go a little bit more split stance, have your feet further apart. Okay, single leg stance. So just basic, just being upright, getting out of chair, just activities of daily living, and just like, okay, hold that position. Can you control it? Does that cause a problem? And pretty much everything we did to him was causing chaos, causing turmoil internally. And we would just restore function, and we go back to the challenge. And when the challenge doesn't trick him up again, we'd move on to another challenge. So I probably worked on him. I did about a 2-hour session, and then so he felt like super fatigued for about 24 or 36 hours afterwards. And then he had like 9 days like symptom free. And like, oh my gosh, it's amazing. Now he came up 2 weeks ago, and I worked on him like 2 hours one day, 2 hours the next day, and 2 hours the next. We did 6 hours, and his symptoms he actually got worse for about 3-4 days, and then he kind of settled back to where he was, but it didn't really get that big outcome change we were hoping for. So that's just a recent guy that I've been working with. So I don't know that I have enough case studies to say, okay, here's what typically happens, because I don't know what typical is yet, because I've only had a handful of these people so far. I know Damon Patterson, one of our definitely leading students. He's out there in Dallas Fort Worth area, and I know he works with a lot of football guys. So he's had some. I can't speak about his specific case studies, but I know he's had some pretty cool successes with some. I'm guessing they're football players, but I know he's had some TBI guys that have done very well. I'm sure there's a couple other Square One people that, if they end up watching this, maybe they would make comments and stuff if they.
Yeah, absolutely. Yeah, guys, let us know what you think. I mean, if you're watching this on YouTube, leave a comment below about your stories and success with this. I'd love to get the information out. And,
absolutely.
Because I think of it from this standpoint a little bit, Shawn. Like in the sense of a concussion, because you're utilizing inputs, right, to basically make the brain happy, right, essentially. And but the thing is and to not perceive a threat. But let's utilize the concussion again as an example. If a kid gets hit in the head, right, and all of a sudden they have like this cranial compression within the frontal lobe, well, then that's going to subsequently alter a lot, because with the cranial compression, the suture compression, that's going to change how the oxygen and cerebral spinal fluid is pumping across, which is going to influence how the brain coordinates, to the cerebellum, in regards to movement. So how are we taking that into consideration, utilizing Square One?
I would say I'm not taking any of that in consideration. I'm looking at it. If the guy got out of his car and walked into my office, I'm going to check getting in and out of a car and walking, because he's going to do it anyway. So I literally try to meet people where they are and say, hey, here's what you have to do. Here's what you're already doing. So I'm not going to go, hey, let's go to Crazy Town, let's do cartwheels and shake your head around. I'm literally like, hey, let's just make sure that putting one foot in front of the other, let's start there, and let's just see if we can get some order there. Because if we can get where the brain doesn't have to work so hard for this person just to stand up, sit down, do some mouth breathing, do some just really low grade type inputs. And if I can just get that calmed down, that gives that guy a little bit more of a buffer and hopefully facilitates that healing process. Because like you're saying, if you have that tissue damage in the brain, that's not healing tomorrow. I mean, like nervous tissue, brain tissue heals very, 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 very slowly compared to like, a ligament or a muscle or a bone, which, matter of weeks or, a few short months. Nervous system or nerve tissue heals very, very slowly. So I would say that we're not even thinking about that. I'm just trying to set the conditions where the brain doesn't have to work so hard on everyday activities, so the brain can do its magic and allocate resources as it sees necessary to expedite the healing process. All control, just making stuff easier on the brain is all I'm trying to do.
But it still comes down to a lot of times to like, okay, let's let the John, the Jack Cruzes of the world do the diagnosing. Let them determine what damage was done. Let the and then that's really not even Square One's job. That's the job. It's the job to reduce the threat to the brain, not so much diagnose what the injury was to the brain.
Right. if the brain has to, produce less effort to do just basic ADLs, activities of daily living,
Yeah.
well, that's a win. And we'll say, hey, we'll let the dust settle. Hopefully, hey, maybe in the next month or 6 weeks, some outcomes start changing or whatever. And again, I think setting the conditions up for expedited healing would be, in a nutshell, I think what we're trying to do with brain injury, ankle sprain, just insert issue. That's all we're trying to do with everybody.
All right.
Cool.
And I do believe too that, again, I mean, John, just like you and I were discussing on our last podcast, you know, as opposed to, us trying to diagnose an injury or diagnose this problem or that problem, again, that's going to be medicine's job
Yeah,
Yep.
to
absolutely.
diagnose those things.
Yeah, it's not our
You know,
job. No, we don't do that.
it's going to be, that is outside the realm of what Square One practitioner, unless
Yep.
Square One practitioner is a physician,
Right.
let
Yeah.
them, they can do whatever. But
You're right.
but as far as, but this is to deal with the way the brain perceives, and I would imagine that this is the same thing would hold true of neurotargeting to a large extent. Although neurotargeting would also have a lot of physicians that do that, so they would have that ability to diagnose.
Yeah.
But in that sense,
Yeah, but I'm
it's
not talking about the diagnosing side of like the three of us, because neither of us are doctors. I mean, if anybody
Right.
could, you're the closest one, Chris.
Right.
yeah,
Right, yeah.
you
I'm
don't,
just
you
saying
don't want me doing that.
when you have these other elements that play a role in how the brain is actually communicating what it perceives as a threat. That's kind of where I was headed with the
Yeah.
question, not in the sense of trying to diagnose it, because no, I don't touch that with a 10-foot pole. No.
Yeah. So back to your question then, John. I think it's just I would just proceed very cautiously and say, look, I'm not going to use anything triggering that's like outside of what you're doing right now. So if the guy's like kind of bedridden and he gets up to eat, and that's about all he's doing, like, all right, well, we're going to get you vertical. We're going to get you sitting, horizontal. I'm going to have you chew some food. I'm swallow, get up and just walk around. I'm going to do really low grade. Like, hey, you're doing this already. Let's just start there. And if we can get that under control, then we'll see how things go. And then the second session, then we'll just go we'll push the envelope a little bit. So then it's like, hey, let's walk with your eyes closed and just amp it up a little bit. Just micro progress with these triggers.
Right.
No, that's great. What what about things like autoimmune issues? And I bring that up because obviously you're not treating autoimmune,
Right.
but I see a handful of people with MS. I've seen some other autoimmune things, and our job, Shawn, our job is the same, right? We try to put the body in a place where it's working for you, not against you. Let the doctors handle the autoimmune issue. But the way I look at it is, okay, let's try to get the body working for you as much as it can. But when you have something like an autoimmune scenario that's just constantly attacking the system,
Right.
I'm just curious, what is your experience in trying to utilize Square One and the challenges that maybe you see in just trying to keep things working the right way?
So one condition that we've seen, like, man, like I hear this one, I'm like, awesome, this is going to go so well, is fibromyalgia. So when people have come in with that, and I know people they're rolling their eyes. I know there's no like objective data say this is fibromyalgia. It's like, it's a bogus diagnosis. But okay, maybe it is, but it's a real thing. Whatever
But it's
it is,
real to the
it's
person,
real.
whether regardless of what the practitioner thinks. Right, it's real.
Exactly. Like the people come in with this certain set of symptoms. It's like, they can't put their finger on it. Like, okay, but these people come in and tell us they've had fibromyalgia, have done unbelievably well to the point where sometimes we'll clear out 2, 3, 4 layers, and they're like, "Oh my gosh, I already feel bad." I'm like, "Wait, like we're just getting started." Like I'm almost like, it almost feels like a
Yeah, I know the feeling. I had the same response. Yeah.
Yeah, like it's like almost like it feels like is this like a placebo thing going on here? Because it's classically super fast with the fibromyalgia. So every time I hear autoimmune, I go right to fibromyalgia. I'm like, and I got like, all right, this is such a great fit for that. I'm trying to think I'm trying to think other autoimmune stuff that I've seen. That's probably the most common one I get. What are like Hashimoto's? I mean, I don't know. Like the symptoms associated with that, like thyroid stuff and like the goitery type deal and slow metabolism, or hypermetabolism. I've never seen someone when with fiber or Hashimoto's when it's swung really low or swung really high. I usually see them when they're kind of more of a stable place. So I wouldn't say that we did a Hashimoto's and there's this crazy change. I can't think of a really obvious big one there. But the fibromyalgia, that's money for Square One. So
Interesting.
Yeah.
That's cool. That's cool.
Yeah.
I haven't really seen a whole lot of fibromyalgia. Like I said, I see a lot of the MS. We've had a lot of good success with that. I know NewFit. NewFit's had a lot of success with MS. And
Nice.
Garrett, if you're listening to this, yes, I will take the course at some point. But it's the same thing though. Is like I proceed with excessive amounts of caution because it's like, oh man, you're exhausted just lifting your leg, and provide a stimulus, and all of a sudden they're like, holy shit, I feel great. It's like,
give a little more
okay, I guess the session's done.
Man. We've had so I personally haven't seen. I don't know if I've ever worked on somebody who has MS with Square One. Prior, when I was just doing MAT, I had a few, and that responded fairly well as well. But I know some of our students have had some awesome MS stories and Parkinson's. We've seen some really, again, not me, but
cool.
I've had students that. There's one I probably reshare on Instagram maybe twice a year because it's such a phenomenal. I can't remember the 7 symptoms you get with Parkinson's, but this guy had everything except for the tremors. So his physical, like fatigue, hunched over, weakness, balance issue, all the other stuff. He didn't have the tremors, but his posture was like, it was, the standard classical American upper cross syndrome times like 100. This guy's like he's like 6 inches shorter than he actually should have been. And the practitioner took pictures of a profile standing at session 1, at the end of 1, at the beginning of 2. And in 2 sessions, the dude went from like, whatever. If he was 5'7" in the first picture, he's like 5'11" at the end. He's like 4 or 5 inches taller. His shoulders are back. He had to readjust all the mirrors in his cars because he's sitting up taller. So that guy, it's a really visual, like, wow, like undeniable change with that fella. It was cool.
But the system itself, the Square One system, is the same, regardless of whether you're dealing with someone with an autoimmune issue or someone with a TBI or somebody who's got an ankle sprain. It's still it's the same system. You're still going to assess everything exactly the same way.
Yeah, and that leads me to, as we're talking about this stuff, it's like what just popped in my head was the 2 questions I ask everybody right at the beginning of a session is, okay, tell me about your head injury history. So I've found that when people have had 2 or more concussions, so car accidents, football players, hockey, whatever, just if you've had your head knocked twice, those people tend to get very dizzy during our session or right after as they're adjusting to the changes we're making. So, and we don't have any like real horrible stories with it, but I just like to know that so I can kind of warn them, like, look, this is probably going to make you a little dizzy. So what I've really found, I just want to make sure, I don't want to have them change levels. I go horizontal, vertical, horizontal, all session long. So I might just do a totally upright session with someone that had recent head trauma. So that's one question. And then the other thing is, hey, any recent traumas that you haven't had diagnosed yet? Like, you're playing sports. Did you bash your knee or did you wreck your moped last week or anything? Like, is there something new that do I need to send this out to a doc before I feel comfortable? So it's usually head trauma and just recent trauma throughout the body. Those are always my qualifiers I ask. I don't want to hurt them. I don't want to get in legal trouble, but I mostly don't want to hurt them. So.
Yeah, absolutely. Client safety priority number 1.
100%.
Yeah. So, all right. As we get close to wrapping this up, I want to revert back to the performance side of stuff a little bit. And I think this is at least from my standpoint, and I would imagine quite a few other coaches out there deal with this situation. We had Marcus Schreier on a couple weeks ago, and he had a lot of good information. I don't really know what type of quote unquote system he utilizes. I know he's the founder of the Neuro Institute, things like that. Okay. But I don't really know what his system is. But I made a comment, and it kind of went a little mini viral with his stuff. And it was a statement that I know I've seen a lot, and that is, I said strength is not the end all be all, but that's what a lot of people want. That's what parents of athletes and coaches, they want the strength side of it. They don't want all the neuro bullshit. How, as a coach, do you communicate the value and importance of this when a lot of them just think it's just voodoo?
Yeah. I would say that's like asking, I want a delicious tasting dish, and I don't give a shit what kind of ingredients you put into it. Like, that's like you don't get to have both.
Is that not normal, though?
It doesn't make any sense. To me, it all starts with perception. If your brain perceives a bunch of things in the environment, the ground itself, as a threat, well, how strong can we get? We get stronger, but it's going to be nowhere near your full potential. So if we can just get your brain better organized before we start down this strength thing, we're going to give you the strength stuff. But you want to have a higher ceiling and you want to get there quicker. Let's get the brain in order, and we'll do this. So if you want to go the slow and the lower ceiling version, all right, let's skip the neuro stuff and we'll just do strength training. That's fine. It works. But if you want to really amp this up and give yourself an actual advantage over and do what other people aren't doing, that's just what we're going to do. And if you don't want to do it, that's totally fine. They're 99.9% of the industry. They'll take your money and they'll have a relatively low ceiling and it'll take forever to get you there. But if you want to get there faster, safer, and a higher ceiling, like let's address the brain first, because I thought don't we all agree that the brain controls it all? So like let's just get this in a little bit better working order. Let's start there. That's the order of operations. We start with the brain and then we move into the tissue and all the stuff you want. We're gonna get it, man. But if you focus on the process, the outcomes are gonna be there more times than not. So
hell yeah, it's
so
good
much
stuff,
of it
man.
just comes to like what your brain is willing to allow you to display.
totally,
If you can't,
man. Totally.
if you put in that threatening environment and it won't even let you show what it's capable of, yeah, it's not going to work.
Right,
So,
man.
absolutely.
Like, unleash the beast. That's what we were saying a couple of years ago, man. I'm just gonna let your inner beast come out, man. Like I know he's in there, but you had 2 surgeries and 3 ankle injuries. Like let's just get this organized, and you're gonna be happy with it.
Yeah, it's good stuff, man. Really good stuff. Okay, I think we started this segment after you came on the original time, but as we wrap this up, final thought here. One piece of advice you'd give to really anybody, whether it's current practitioner, somebody thinking about getting into this.
So you're talking like in the field, they're looking to get into this stuff, just generally.
Sure, just a piece of advice you'd give somebody listening to this.
All right, so someone's listening to this. Honestly, this might even be for coaches who are in the field right now, athletes, that sort of thing. I know I'm not going to say this just because it's kind of hot the last 2, 3, 4 years, but as I experiment a lot of different people, man, a real low-hanging fruit has a big impact is that nasal breathing. So I think it's a really easy thing to slip in between sets while you're performing an exercise in game situations. If you're a hitter, playing baseball, softball, you see the pitch, you step outside the box, take a big nasal breath and get back in there. So nasal breath plus any eye movement whatsoever is a reset. So that's a super easy thing that athletes can use right now, and right now coaches, without knowing anything else, hey, after every set you run your client through, your athlete through, just have them like do an eye circle and a nasal breath. You won't even, it'll be like magic, but there's gonna be certain people, like cool things start happening, whether it's in the first session or a couple sessions in. So that's like a real, hey, here's a 1/2 second thing you can do that has a massively profound impact. That would be
awesome.
That's a
Nice.
Awesome. Anything you want to add, wrap up with? Any new comings with Square One? Anything you got coming down the pipeline?
Yeah, I've been talking about this for a while. The book has been in process. The rough draft's been done over a year now, so that's on the horizon. I'm hoping here. It's not going to be finished up 2023. I got too many other projects going on, so that's something to look for in the horizon. And then I'm going to put out another online product that's going to be really cool. So those who are familiar with with Square One. It's cool and as awesome as it is, there's a little bit of skill to it. You got to work with it a little bit. Signal 6 is on the other end of the spectrum. It's Square One inspired. No skill, no assessment. I'm going to come out with a product that has a little bit of an assessment and no skill. So it's gonna beat the crap out of Signal 6, and it's inching closer and closer to the full Square One without having to learn the muscle testing piece. And that product, I don't know, that should be done this year. Price point's going to be very affordable. I foresee that being like $100, maybe $150, and it's going to be something that you can run in one-on-one situations or groups of 100 people. So it's going to be very malleable, very impactful. It's going to be a very cool piece that I think I'm really excited about it. So
awesome.
Yeah. So
awesome.
Thanks for share about that. Thank you.
Oh, for real, man. Absolutely. This is all community, right? Trying to help everybody across the country. So, man, it's great having you on again. Always love talking
Shawn.
to you, bro. Always good stuff.
Much love and respect to you guys. I really appreciate you guys giving me an hour of your audience's time and doing this with me. So I thank you, both of you guys.
Real talk, you do a great job. I love the stuff, and we'll keep as long as this show continues to run. We'll keep bringing you on.
All right, I'll be like one of those stand-up comedians that Joe Rogan brings back in all the time. Right? I'll be
there. You go,
Bravo or something for Rogan.
Yeah. All right, well, guys. That's the show, guys. If you liked what Shawn had to say, just go share the show, please. And there's a lot of valuable info there, so I don't know why you wouldn't share the show. So get out there, share it. Appreciate you guys. Love you guys. Talk to you soon.
Hey, guys.